Hi guys, Doula Caree with Moon Cycle Mama Doula and Wellness LLC. So first I want to invite and welcome all of our amazing parents and all of our amazing caregivers because this is a topic that you guys requested and I am giving it to you. So, if you guys are wondering what to do with that little stump that's on your baby's or your newborn's belly button, and you're wondering what to do with it, don't worry, you are not alone. In today's video, we're going to be breaking down exactly how to care for your newborn's umbilical cord safely, gently, and stress-free. So go ahead and let that sink in. Okay, guys, so if you are sitting comfortably and you are ready to get started, we are going to start off with section 1, keeping it dry. So, when I talk about keeping it dry, I'm talking about keeping the cord stump dry. So, gone are the days of alcohol wipes and things like that because most experts are now recommending dry cord care. Basically, that means no fancy products are needed. Just gently pat the area with a clean, dry cloth if it gets wet. And to make sure that the diaper is folded down below the cord so there is no chance for rubbing and there are no chances for moisture getting trapped in that particular area. And then we're going to go ahead and move on to section 2. And section 2 talks about don't pick or pull. Now, if you're a parent and you're looking at this, and of course your baby is in pain possibly, or you're just looking at this and you get that habit to either want to pick it, pull, or if it's like little lint balls from the clothes that the baby might be wearing or from the Pampers, you might want to pick and pull. This section, none of that. No picking, no pulling, no none of that. Yes, it might look a little shriveled, even gross, right? But that's totally normal. If, it will fall off on its own, I'll say in like maybe 1 to 3 weeks. But pulling it off too easily or pulling it off too early can cause bleeding or even worse, an infection. So let nature's do its thing and you keep your hands to yourself, right? Okay, so then moving on to section 3, give it some air. Please give it some air. Now next, give that belly button a little air time. Yes, I'm talking about air time. Loose fitting clothes and avoiding tight onesies will help this area dry and heal naturally. Basically, more air equals faster healing. Yes, honey, yes, I know. I didn't want my babies to look like that either. And just looking at it, making me feel like, oh, is it hurting? Is it dirty? What can I do? That's why I spoke about no picking or pulling and allowing it to dry and just to keep the air flowing in, which equals faster healing. Yes. So, I wanted to make sure that while we're doing this video, anytime you kind of see me look over into this direction, it's because I've created a full, thorough, section by section of all the sub questions that was asked or follow-ups to the title of our video. So because of that, I want to make sure that within this video, I'm able to touch on every point. So that's a little brief explanation on why you might see me drifting over there, just kind of looking at things and making sure that I have accurately provided you guys with information. Okay, so let's go ahead and get into section 4, what's normal and what's not normal. Now, again, let's talk about what's normal and what's not. Okay, so first thing, a little dried blood, that's normal. But if you see redness and swelling, pus-like discharge, a bad smell, or your baby has a fever, those are all indicators that there may be a possible sign of infection. Although it may be rare, but it's definitely important to call the baby's pediatrician right away, like immediately, if you notice any of these signs when dealing with the babies or your newborn umbilical cord stump. Okay, so just moving on. And again, make sure you reach out to your pediatrician if you notice any of those signs that I just mentioned previously. So we're going to move on to section 5 as now this umbilical cord stump has fell off. What's next? So when the cord stump finally falls off, don't be alarmed. Don't be alarmed if you notice a little blood or fluid. That is perfectly normal, and it's also a part of the healing process. So keep gently cleaning around the area until it's fully healed and dried. Now, before long, you will be kissing that sweet baby's little belly and, every chance that you get. So I want you guys to go back through this full video, pick out those sections that you guys had questions on, and you can see that I've answered those questions in this video. If you do have further questions, please feel free to contact us at mooncyclemama.com. And until next time, guys, thank you again and keep leaving your questions and I got answers. Bye. Oh, I wanted to make sure that I jump back on and tell you guys this. You are doing an amazing job. An amazing job. If you have any questions, again, you can feel free to reach out to myself, Moon Cycle Mama Doula and Wellness LLC, health and wellness, as well as doula support. Also, of course, you have your resources, your baby's pediatrician, your doctors, things like that. But I definitely want to let you know that you are doing amazing. You don't have to have all the answers. Hell, I don't have all of the answers, but I know that there's resources that is basically hugging us as a community to provide us with the necessary resources and answers to those questions. Now, caring for your baby is a journey. It's a learning journey. So you are not in it alone. If you ever feel unsure, reach out again to your primary care physician, to the baby's pediatrician, to your doula, your postpartum support team, which is me as well, and your others. So I want to let you guys know if this video has helped in any form or fashion, has helped you to ease your mind, go ahead, give it a like, hit subscribe, and that bell so that you can get all of our alerts when I am live or creating awesome new content. And drop a comment below with any newborn questions that you'd love to see answered by myself on video just like this. And again, you got this, mama and papa and grandmama and our amazing caregivers. You guys got this. And I am cheering you guys on every step of the way. And again, this is Carrie Honeywood, doula, lead doula, with Moon Cycle Mama Doula and Wellness LLC. And again, I am here cheering you guys on along the way. And if you have any questions, feel free to contact us. And again, that website is www.mooncyclemama.com. Okay, till next time, guys. Bye.